evaluating health information. My name is Becky Corran, and I am a professor of public health here at Doña Ana Community College. And I see that there are three of us who are going to be presenting today. I'm one of the presenters, and I'd like to hand it off to Jose to introduce himself, and then Amy, and then we'll get started with the presentation.
Thank you. Hello, everyone. Good afternoon. My name is Jose Aranda. I'm a librarian at Doña Ana Community College. And this summer, we have been presenting a series of online presentations on various topics. And I'm very eager to be part of this collaboration today on health information. Thank you.
Thank you. Amy, do you want to?
Hi, my name is Amy Collins, and I'm a professor with the Public Health Program. And I'm also excited to be able to join in this activity. I think it's a great time for us to increase our knowledge about how to find accurate information. It's also really great to be able to reach out into the community.
So I'm just going to share my screen, and so that you can see what we're talking about. But please feel free at any time. There's going to be time for questions at the end of our presentation, and then there'll be an opportunity for more at the end of Jose's presentation. But if you have something that you need clarification on, or are wondering, or you know, just open your mic and speak up, because that will be the easiest way for us to recognize you. I probably won't be able to look as much at the chat, although we can look at that some, but definitely if you have questions, please let us know, because we want to make sure that you feel comfortable with the information we're presenting. So thank you so much for joining us this afternoon, and we'll get started. After today, hopefully you will feel more empowered to evaluate health information and identify relevant resources to help you do so. We'll cover fake health news, and this is really relevant at the moment, how to identify it, and then we'll look at how to evaluate sources, where reliable web resources are, and how do you tell if something is credible or not credible. Some key terms, and then we'll turn it over to the library to see all the ways that they can help you in doing this. So, why does this matter? And I think that as we were thinking about this presentation, we were thinking about the context of people generally at this moment. There are a lot of places where people are getting health information. Some of them are reliable, and some of them are not as reliable. And it's really important to be able to understand where that information is coming from, what kind of research might be behind it, and really your health is too important. And right now we're in a moment where our health, like big global health crisis, is something that's affecting us all really, really seriously. So it's important to keep information in mind and be on top of all the things that are going on. I've included here a little bit of research in terms of why this matters. And this was related to health information that people got from the internet. And it does show that we don't recall fake information quite as much as we do real information, but still, even when we see fake information on the internet, about 40% of the time we remember it. And so this is partly why it's really important. There's evolving research on how we remember information and where we get information. It's really important for us to be able to make sure that we're paying attention to the most important things, and how to verify what we're hearing to make sure that we give our attention to the appropriate messages. You might wonder what fake health news is. I thought we would give a little sort of background on this and why it really matters. It's a made-up story. It's created and distributed in ways that are not reflective of journalistic practices. It isn't really something that you don't agree with, although again, we'll give you tips later, but things that make you really angry or make you really sad, that's usually a red flag. So if something makes you feel really passionately about something, it should already be a red flag. Not necessarily fake, but that is a sign. And the reason that this is so important is if you look at the top 5, what's on your screen right now are the top 5 most shared articles about HPV, which is human papillomavirus. It's a fairly common infection that many people in the United States get, and that can lead to cervical cancer. So it's an important topic to know things about and understand. Of the top 5 articles that were most shared, about this particular disease, the top 3 were all fake. And so it's very likely that you're exposed to this type of information, and we're going to give you some ideas about how to parse it all out and make sure that you're not influenced by things that aren't necessarily true.
Actually, I really like how you approach that topic. One thing I would think of, because I mean, I'm human and I also get caught up with fake news at times, is we should always question, why are we reading this news and how is it kind of affecting us? And I do think it's important to think of those responses you have. Sometimes we like to be backed up with what we want to believe, but when you're reading information, I think you really have to have a little bit of a lens as to, is it real or is it not? Or is it really just backing up what I want to be true? And especially right now, there's so many changes and things that are uncomfortable, but that's why it's important for us to have reliable sources. So sometimes I'll read something and be like, oh, I was hoping that was true. And then I look a little further, I'm like, and it's not. But it made me feel really good. So sometimes it's important for us to think of why the information, why are we researching the information? And it really is to make sure that we're making smart decisions and that are going to impact our behaviors, especially now in our current situation.
And I'll give an example from just a few weeks ago, probably about 4 weeks ago, I would say. I started to get this feeling like I'm trapped in my house. I can't stay here anymore. I haven't seen my friends. I haven't eaten the foods that I like. I haven't even been on the other side of Las Cruces. If you're in Las Cruces, you go from side to side in Las Cruces all the time. I thought, I don't even know if the university construction's still happening. And I thought, I just want to go out and maybe have a snack with my friends and see them and just get together. And that feeling, I think a lot of us have experienced in the last few months. Then I looked on the internet and there were a lot of folks on my Facebook feed and on my Twitter feed saying things like, oh, the virus isn't so bad. Things are getting better. Don't worry. We're on the upswing. Everything's going to be okay. And I even felt like, because that validated that feeling and because there was so much information on the internet that seemed to suggest that's where we were headed, that and I'm a health professional. I know the realities of the situations and I see the data every day, but I still felt like, I think I can go outside. And so that type of decision at this moment that we're having to make those things and realizing all these influences, and many of them do have to do with our emotions and our feelings, and recognizing that we're all subjected to that. It's just, we have to sort of think about, where are we getting our information and is it reliable? Should I double check my feelings and the information that exists to make sure that I'm making the right decisions? I didn't go out, by the way, even though I did spend 2 or 3 days pouting about it. So the other thing about this is we often turn to the internet. That's where we get all of our information now. And there is a lot of not very good information available in the world. And I think, I think I heard that just NMSU has something like 7 million websites associated with it, or 2 million or something like that, just the university. So thinking about the vastness of all of the information that exists, it's really hard to sort through what might be a good source or something you might want to question. So the most reliable sites are created by government agencies. So we've all been looking and listening to the Centers for Disease Control and Prevention, the World Health Organization. Our New Mexico Department of Health has been a really good source of information in this pandemic crisis. So those websites are typically and historically a good place to turn for up-to-the-minute health information. And again, there are some caveats to this, but from a public health perspective, these are the places that we would look first. Universities who are probably doing some research in these areas, and the websites that they might be creating, and also research organizations like the New England Journal of Medicine and the Lancet are 2 of the biggest health-related journals. And I think what's really cool to know now, just on the internet, almost all real journalistic organizations and health research organizations are making their coronavirus information free. Sometimes it might be a little bit harder to access some information, but right now places like the New England Journal of Medicine are not making people register or do anything for their coronavirus related information. And so it's a moment where you can definitely find more information just freely on the internet than perhaps at other times. So I think it's important to take note of that. So here's an example from the New England Journal of Medicine that just, again, this just came out, or this sort of came out a long time ago, but now it's relevant again. And I just want to give you a few tips on how to tell if you're using a good source. And we have some additional tips for this as well as you go on. But one of the first things is that it conforms to APA standards. And APA is the American Psychological Association, but it's really the way that we format things in terms of references. It's in sciences, it's one of the primary ways that people format their references. And so we look to that to see the legitimacy of something. So if you're a student and you're writing a paper, and you have to write that paper in APA format, if you're filling in the references and suddenly you realize, oh wait, I can't find the author on this article, then you would probably question, I would say you should question where that article is coming from. If you can't identify a person or people or an agency that's authoring the article, that's a red flag sometimes, because who knows, not knowing the author is a little problematic, because if you have a question, how do you follow up with them? So can you find the date that it was updated and the date that it was published? At this moment, there are a lot of, and you can see that on here. Here's the author, here's the date that it was published. In our environment today, the date of information is critically important. So things from March aren't even necessarily relevant if we're looking at coronavirus related research today, because we have so much more information. But if we look at other things like thinking about chronic conditions like diabetes or cancer or heart disease, there are many places that have been collecting that research for many, many, many years. And so we can look back further. So knowing when something was published and if it's relevant today is also a really important part of that. And you'll remember that from your APA formatting if you have done those references. You also always want to know the publisher or organization where the information is coming from. And I'm going to show you an example of why this is really important in a second. But typically, we look for, in public health, we look for publishers and organizations that are research oriented and typically neutral in their interpretation of things. So universities are commonly considered the main place where a lot of researchers happen. Governments also, government agencies typically try to keep their information neutral and publish things like just the facts. So for instance, in New Mexico, you can look at the data about cases, and when they tell you how many cases of coronavirus there are at this moment, that's just that data point. And so they aren't saying why. A lot of people will write articles and think about why and make speculation, but looking at the publisher and seeing what their motivation is, in cases of like government agencies, their motivation is to get the information out so that people can start thinking about it in different ways. And one of the last things is all of the authors are included and all of the sponsors are included. And this is something that in health research is always a really touchy subject. So big organizations often sponsor research so that the research will turn out in the way that they want it to. And so it's really important to think about who paid for the information to be in existence. That's why government agencies are typically more reliable, because the taxpayers often pay for that information to exist. It comes out of our sort of tax paying that we have the Centers for Disease Control and the New Mexico Department of Health. Today in our environment, if you think about a really specific example of this, I don't know if you all have seen, in the last 2 weeks, there have probably been 5 different articles related to coronavirus vaccines. In many cases, those articles or the stories about those articles are coming from organizations that have a financial stake in the companies that are developing the vaccines. And so it's really important to know, and that doesn't mean that it's necessarily a bad source, but if you can't tell what the source of information is, then you might want to question who's sponsoring, who's paying for this research, and what's their agenda. So I think that's a really important thing to think about, especially in this environment, so that you know where that breakpoint might be. And so typically if taxpayers are paying for it, so that's where we look to government agencies and universities, who researchers there are often paid through federal grants that again come from taxpayer money, if those are we expect more integrity in those places where we find the sponsorship is more publicly oriented. So always be able to look to see who is sponsoring the research and make sure that it's someone that you can trust, or at least you know where the money is coming from. So I want to, this is particularly relevant, and this is one of my favorite places, and I have lots of students, and lots of students write papers, and they often cite WebMD. I personally go to WebMD at night when I have a tiny bit of a headache, and I think, what's wrong with me? And I don't know if you all have ever done this, but you search for, I have a headache on WebMD, and suddenly you could either have nothing or cancer, and potentially be, fatal cancer that you might die from in a few weeks. So take everything like a grain of salt when you look in places like WebMD. And I say that in particular related to the idea of sponsorship, and the idea of what information is coming from research and what information might be propaganda. So one of the things that I think is really interesting, and this is a page from WebMD, you can see a couple of things on this page that I'd like to point out. One, first of all, in the article, and I cut it off so that it would be very visible, but there is no author listed here. Furthermore, it has 2 references to federal agencies, the EPA, the Environmental Protection Agency, and down below, the Centers for Disease Control and Prevention. But you'll notice that neither of those include links to those actual agencies. So for you to check this, one way to check it would be to go to the Environmental Protection Agency and see where the article is that highlights this, to see if it really is true, or the Centers for Disease Control and Prevention survey that it mentions below. None of those things are referenced in this article, and so that should be always a red flag. One other thing that I really want to point out about, especially about WebMD, and people who shop on the internet all the time are so used to filtering out ads that we do it kind of naturally, but the ad makers have come to make some of these ads really look like they're actually informational for you. And so I really encourage you to think about where that information is coming from. In particular, on the right side of your screen, all of those articles are sponsored articles, so they were paid by someone. And it may or may not disclose that they were sponsored articles. And then on the last side, I just want to point out this Tylenol ad, which the preceding, this is sort of a flash ad, and I only caught the second part of it, but the preceding part of this ad said, do you have these symptoms? And it sort of gave a little bit of a quiz to see if someone had certain types of symptoms. And the general rule for health information is, you should never ask a company that's going to sell you a cure if you have the disease. That's the rule always. However, if you look at WebMD, you'll notice a lot of companies that have the cure trying to sort of get you to click on their ads. I have to admit, I don't think they're going to say, no, you don't have this disease, you don't need our product, because that's not how advertising works. But we do go to WebMD to see if we might be sick. And so we're sort of prime candidates to fall into that trap of not realizing that we're asking the people who sell the cure if we're sick. And so that's always a problematic situation. And so I think this is a really good example of how you can filter this information. There might be a kernel of truth here. We could look at the EPA website and see what it says about Lysol. We could look at the Centers for Disease Control and Prevention and see how people are using disinfectants to control coronavirus. But this, in and of itself, please don't take it as the end all, because we don't really know what's behind this. For all we know, this could be a paid ad from Lysol. So, which it could be, it could not be, but it would be good to know in advance of, I don't know, buying all the Lysol at Walmart, if there is any left, which I'm not sure that there is. I think I'll defer to Amy for this one. I think she's...
Okay. Thank you very much. I'm sorry to hear about those late night headaches, Becky. A little bit of yoga might help instead. So this is probably information that you guys have, so I'm just highlighting some of it. But it's really helpful to me because, again, when I'm looking for information, sometimes I like to find the things that are satisfying to me rather than what are accurate. So it's helpful for me to know where it's coming from. So I probably have too many words on this slide, but I'm going to read through those and talk about them just a little bit. And these are just 3 main points that you can use when you're looking for health information online. And this goes back to really identifying the source. And so one way you can do that is making sure that you're paying attention to the web address. So Becky highlighted some credible places that we go to get resources, but you could also verify the web address where it's coming from. And it's not as easy as it should be, in my opinion. So you might want to look and see, are there spelling errors in the company name? So you may have received some information and think, oh, you know, really quickly looking over it, that it looks like it's coming from a very credible source, and that's just a minor typo. But it's really not a typo. It is just not accurate information because it's not actually coming from that place. Another one is that there's strange sounding extensions for the address, such as Infonet or Offer. So again, this goes back to become familiar with the credible website and locations, and just make sure that that's what you're looking at. So that other thing about the extensions is you want to be sure that it's something you're very familiar with, and it's not, you can tell Infonet is obviously going to have some type of profit behind it. It's a marketing type thing. So that's an example of fake news, is when it's spelled wrong, or if the extension at the end is something that you're questioning. And then, just like we were already saying, is always go with trusted sources. And that does make us realize we have to know what our trusted source is. So some of the examples that I think all of us right now are comfortable with would be things that Becky mentioned, such as universities, and that's going to be represented with a .edu. So it'll have the web address, and at the end we'll have the .edu or a .org, which is going to indicate, going back to what Becky was saying, it's really a nonprofit, or it's being paid for by tax dollars. So you're really linking it back to, this isn't being marketed and there's not a profit into this. And so the information is going to be more valid rather than pushing a type of product. And just like Becky was saying as well, this really ties back into the publisher. Is the publisher reputable? Are they professional? Are they an expert in the subject matter? And we have many cases, even in our lifetime, where we've received information and it's been very publicized from maybe somebody who's famous about, you know, what's happened to their child, and that's become quote unquote science. And that's an example of fake news, because you really have to go back to what is the evidence and find the source of what the information is. And so in those examples, it can do a lot of damage, because it drives people to make decisions about their health and health products as well. And then the last point that I have on here is also just highlighting what Becky has said as well, but verify the information. So oftentimes it can be represented. So just as in the example she gave before, is it might say that it came from the World Health Organization or from the Centers for Disease Control and Prevention, but it really is worth taking the extra few minutes to verify that, because you can easily just search it within their site and see if that information is credible, if there is a article that relates directly to that, and then you can be comforted knowing that it's accurate. But otherwise, they would have already put it on there for you. So that might be something that is leading you towards fake news as well.
And this has become such a sort of epidemic of false information in the environment of coronavirus that a bunch of scientists actually got together and looked at ways that you can sort of spot misinformation. And this is particularly relevant to social media, where you might be getting a lot of this at the moment. Is the source vague or untraceable? This is one of my favorites right now. You know, insert a picture of a healthcare professional who works in some place, right? A doctor friend of a friend, or a nurse friend of a friend. Or if it says generically scientists say, which scientists? Are you sure they're scientists? Because that sounds a little vague. Also, emotional contagion. This is something that Amy talked about and that I think is really important to think about. Does it make you feel angry? I don't know about you. I know some scientists and some public health folks, and most of us are rarely running through campus screaming about our topics. We always say, well, I think that this is what's happening, but we need to do more research, and I want to make sure that I'm really clear on what's happening. also in public health, we're never overjoyed because we're usually talking about illness or death. But if a post makes you feel angry or overjoyed or sad, it might be trying to get you to share it because of that emotion, not because it has factual information. People share things because of emotions a lot more than they do for facts. So be careful if you feel that. Check what might be causing it. And actually, this is probably also true for things like shopping, online shopping, but that's a different topic. And then the last thing is, I don't know if you all have gotten this recently, a favorite seems to be, Facebook will surely take this down. And then it tells you something conspirational, something no one else knows, and is being marketed for a certain reason. And almost universally, just like a chain letter that says you must forward this to your friends, typically those things aren't accurate. And one of my favorite examples of this sort of oversharing are things related to weight loss. This is not related to the coronavirus, but one of the things that you see a lot of on the internet are sort of weight loss related schemes or remedies or ideas. And often people will say, I just really need to tell you about this particular weight loss thing. And I'm here to tell you that if there were a magic way to lose weight, someone would be a super millionaire, and they're not. So whatever people are saying about that, it's just universally not true. You can't get younger, you can't get thinner based on something that someone tells you on Facebook, generally speaking. So when someone urges you to post something, take that as a sign that it might not be the most reliable thing. And again, the key thing to do when you see these, or when you feel like someone might be giving you information, especially when you're making decisions about your own life in that moment, find the original source of the information and confirm it, or find additional sources that suggest something different. I think double checking and finding the original source of the information, if you really want to be brave, you can post that on the original post, but I don't recommend it. I would say just take the information for yourself and let the bad info spreaders have their own conversations. But if you do want to spread health information, and frankly, if you want to be a health professional, part of our job is actually to make sure that people have accurate information. Share back your research on how that turned out. I'll go through this part really, really quickly because it's not super important, or it's very detailed and not something you might need to know, but just so you know, if you are looking for research and trying to double check something, you might look for these types of things, and you might hear this type of conversation. Peer-reviewed articles, which I think Jose is going to help show you how to find some of those in a minute, but peer-reviewed means that not only did one researcher do the research or look at the numbers to see something, they sent it into a panel of people who are experts in that field, and those people looked at the research again, sent them back edits, asked them questions, told them that the research didn't seem like it had enough people in it, or enough samples, or enough statistical rigor, and then they went back to it. So it was reviewed by people who are experts in that field. That's the highest level of health research that you can take information from, are peer-reviewed scholarly journals. Other terms you might hear, primary research is when the person does the research themselves, and secondary research is when they're writing about something someone else did. And then meta-analysis, this is something that's really useful now because there's so much research being created and so much data coming at us. Meta-analysis is a statistical technique that allows us to look at many, many, many research studies and see the common information about them. And I hate to bring up this because it makes people sad, but the most famous meta-analysis is, you might have heard a few years ago that bacon is not good for you. It was a really sad week in our history. A lot of people felt really crushed by this information, but scientists looked at hundreds and hundreds and hundreds of articles, and the one conclusion that they found was, if you eat a lot of bacon, it's not necessarily super good for your health. And so meta-analysis just says things very, very confidently because it looks at lots of data from a lot of places. In this case, my emotional insides don't want to necessarily accept that detail. So, take it for what it is. But it is one of the highest levels of research that folks can do.
So if we receive a social message from you on Facebook that says pass this on about bacon and keep promoting it, we should probably just delete it.
Bacon is a diet food. Bacon
Right.
will make you rich. Yeah.
Yeah.
If you see that on social media, it's probably pretty suspicious.
We'll get help for you and realize something's wrong.
Thank you. So I think that's it for our part of the presentation. I hope that it was useful for you, and we'll happily take questions if you all have questions.